There's a lot of talk of masks, even in this country where the risk is low. Masks are in short supply, but they are very important in China. And this is where people like my next guest come into the story. He is the CEO of Oasis Global Partners. That's a private equity company, offices internationally, but critically 2 offices in China. And the normal business of this company is now become not private equity, but indeed helping people in China get masks. The CEO, Aloysius Lo, is with me in studio, and a pleasure to have you in. Thank you very much.
Thanks for having me.
Let me tell you, let me ask you, not tell you, I'm interested in your telling me what you are hearing from people in your offices and people in your circles in China about the need for masks.
Well, China right now is undergoing, I guess, since 2003, the second corona SARS-like virus outbreak. And it's been a long time since 2003. Right now, we have our staff in China. We have their families, some of them in the epicenter in Wuhan province. And it's quite desperate for any type of medical supplies to help the front lines.
We've seen incredible videos of, thousands of people in hospitals and hearing accounts of how they don't have the things to combat this virus properly. And you yourself were in China just a couple of weeks ago, so getting firsthand accounts in terms of the needs. So what are you doing then?
So we came back from China just before the Western media picked up on how bad the situation was getting over in China. And we realized that we at least have the right information, which is we knew what they needed at the front line. And we had to establish whether we could actually get the right stuff to them at the right time. And once we figured out that we had the right lists of equipment and materials, then we basically kicked our office into high gear to source and then logistically send all of these materials that they need.
There are shortages. How are you finding the masks, the proper masks to send? Where are you getting them?
It's incredibly difficult. When I got back into Canada and we basically started asking all of our medical networks and distributor level relationships here in Canada and the United States. We do a lot of work in the United States as well. And basically we thought at the time that it wouldn't be that difficult. The dentists, surgeons over here that run practices, they didn't think anything of it because it wasn't mainstream news yet. But within 48 hours of us sourcing and placing orders, the distributors started to come back and tell us that they can't confirm inventory or stock numbers.
Really? Because the demand has
Correct.
been such.
Yeah.
So have you been able to find and send some?
Yeah, we're about, I'd say, 60% of our way. We committed to sourcing about 50,000 pieces of gloves, goggles, masks, gowns, medical caps. And we're about 60% of the way through sending that stuff over. We still have more to source, and it's getting incredibly difficult.
Is it costing you more too?
Yes, we're paying about double, 3 times what the normal prices are.
When you said we had the proper information to find out where the needs were, I'm wondering, because we're hearing some pretty concerning stories about how supplies and masks are not getting to the people who need it and to the healthcare workers who need it. And even the Red Cross in China has been criticized for the way it's distributed all of these supplies. How can you be assured that what you're getting here and sending there is actually reaching the people who need the help?
So one of the reasons I committed to actually launching this initiative is because we were going to do it ourselves through our own channels, not through traditional aid organizations in China. I wanted to be sure that our efforts would actually amount to something. The amount of equipment we're sending over is probably able to support a hospital or 2 for about 1 or 2 days.
It's incredible. The numbers of people they're dealing with.
Gigantic. So the question has always been, if we can get the right information and if we are confident that we can get the material over through customs, through different quarantine zones, and if we can have eyeballs and contacts and relationships along the way, then we will do it. And when we figured out that we had a good shot, then we started sourcing the materials.
Because of the networks you have already
Correct.
on the place in China. Okay, so you feel confident that whatever efforts you are doing as a company are having a bearing there. What do you think of what I was just reporting, that news that China has not requested masks officially? Does that surprise you at all? I mean, we're talking about now more than 20,000 cases and a demand that is growing every day.
I've been in China for about 10 years, many frequent trips. It's a highly politicized environment over there. I'm not surprised by the reason Oasis kicked into gear is because we know how efficient or inefficient different parts of the country are. And we knew that there would be some very serious shortages over there. And we thought that we could help. So if we knew that the government could take care of everything and the people locally and domestic manufacturers could take care of everything, we would be sitting back and watching television. But we knew that they would run into a lot of issues.
It's amazing. Even though, as you say yourself, only helping maybe one hospital for maybe a day or two, but that in and of itself is significant enough.
Yeah, we want to set an example for everyone else to help.
Fantastic. Aloysius Lo, thank you very much for coming in. I really appreciate your part to the story this morning.
Thank you.